It's time for the 1430 Connection on 1430 WNAV and 99.9 FM, spotlighting news, newsmakers, and important community issues. Now, with this week's edition of the 1430 Connection, here's WNAV news anchor Donna Cole.
Welcome to the 1430 Connection. I'm Donna Cole. In the studio with me today is Nikole Jones. She's the lead suicide prevention coordinator for the Veterans Administration Maryland Healthcare System. And Nikole, thank you very much for joining me.
Thank you for having me.
You know, I mentioned to you before the interview started, while we have all these months dedicated to awareness for such as cancer, breast cancer, suicide, I tend to believe that the topics such as suicide need attention all year long because it's an ongoing issue.
It is. One of the things I wanted to say, I always start with, suicide is a national crisis. Over 40,000 people die each year as a result of suicide, but it's unfortunate that our veterans are identified as 1 in every 5 isn't a veteran. And so we are glad to talk about this risk for our veterans anywhere and everywhere so that we can make sure to get the information out that people do suffer with suicidal thoughts and depression that elevates to that level. And there are resources that really can help them and their families manage that.
And we'll get into those resources in a second. 1 in 5 is a veteran that commits suicide.
And those numbers, and that actually it goes with the 22 a day. And that was something that was identified by the VA when we first started our programs. And luckily we can say that we're actually moving in the right direction. The VA is now saying that it's 20 veterans per day, which is way too many. But what we are glad to know is that we're moving in the right direction. We're really helping veterans that identify that risk within themselves and also get the support of their family and reach out to the resources that are available.
And to be fair, you had some bad press over the past few years. Also, with these rising numbers, have those both attributed to these the more resources you have now available to you and fixing programs that might have needed attention?
Well, I know that our Veterans Hotline, it's a huge resource and that there have been some negative press, but what we know is that it's helped over 100,000 people who've called. They've made over 40,000 rescues of people who are imminently at risk for harming themselves. So those are potential lives that have been saved. And I know that we're working diligently, continuously to improve those resources to make sure that every single veteran feels supported and helped. And so I'm proud to be part of this team.
And how about getting appointments?
I know that they're working diligently to reduce the wait list for our veterans. One of the things I am so proud about this program, the Veterans Crisis Line, if a veteran who was not engaged in
Actually, what is the Veterans Crisis Line?
The Veterans Crisis Line is
the actual number.
1-800-273-TALK. And one of the things I'm proudest about the Veterans Crisis Line, if veterans have not been engaged in VA services, that could be the first call they make. They could actually call and say, well, I've never been to a VA, but I'm really struggling here and I need to engage. And that call to our national number can then start the process to connect them locally.
Okay.
And so that they can get an appointment within our VA. It's an access point for our veterans in our area. And that has been really helpful. Some veterans have really been in need of services immediately. And so we were able to get them in within a 2-week period to see a provider. And sometimes if it more urgently, they can come right in that day.
Okay. So they can come in right
we
on that
do
day.
have some walk-in services for mental health treatment.
Locally, I know you have Anne Arundel County has, I think there's a facility in Glen Burnie, correct?
We have, we call them community clinics, outpatient clinics, and we do have them in various areas in Maryland.
Guns. Talk to me about guns.
Well, the most alarming statistic is 55% of handgun deaths are self-inflicted. And so one of the things that we know about veterans, I tell this story when I do education all the time. If you put a gun in my hand, I'd probably faint. Because I've never had a gun in my hand. But our veterans, they're trained to access those weapons. They use those to protect us. And so they are very familiar with weapons. And a lot of times some of our veterans prefer to protect themselves with those weapons. But the thing about having access to that, it increases the risk. If someone is struggling with depression or suicidal thoughts and they have that lethal mean within reach, it's really important that we find ways to deter that access. And so one of the things that we have is a free gun lock distribution program. And so basically it's a trigger lock that we give to any veteran that requests one. And we encourage them with their families to sit down and lock those guns up so that it protects their children and other people in their home. But also if they're a veteran at risk, we want to make sure that it's a deterrent for them as well.
So they're actually holding a key to unlock it. The veteran themselves would be holding a key, or if they don't feel comfortable or depressed, maybe hand that key to a family member.
Exactly. And that's what we encourage them to do. We want them to have a family member to have access, at least while they're in crisis. We're not saying this, and I always tell our veterans, this is not about gun ownership. They have every right, but we want to make it safe. So in that moment of crisis where the family can identify, hey, something's not going on, maybe we should talk about a plan. It's called safety planning. Mm-hmm. And at that time, if that veteran is at risk, that family comes together as a unit and says, well, what can we do? Maybe I can take the gun lock key, and maybe I could store the gun at my home for a little bit until this crisis resolves. And that's really our message, is we want to get it out there that those lethal means, we want to make sure that when you're in crisis, that you come together as a family, a team, whether it's family or not. Sometimes it'd be your provider, a neighbor, whoever's there who cares about you. What is the plan to keep you safe when that crisis arises?
And let's talk about safety plan. Let's back up for a minute. A lot of people don't know that term. Should more people be aware of that term?
Sure.
What is a safety plan?
It's basically a plan of action when you recognize that that level of depression has gone to the place where it could mean danger for yourself.
Or others.
Or others. Unfortunately, you see this on the news. In the general population, there's an increase in murder-suicides. And so we really want to make sure that we protect our veterans from that as well, their family members as well. But basically, it's planning for a crisis. What do you do? The first section talks about how do you know that the crisis is imminent? What are the signs and symptoms that something is escalating to that crisis level? And that veteran with their family would identify maybe 5 things that they would know says, hey, I might be moving in the wrong direction. There's a crisis coming. And the next level actually talks about, well, what can I do? What are some of the things I can do independently? Reading a book, taking a walk, exercising, some of those things that we encourage our veterans to do to kind of manage their mental health symptoms. Mm-hmm. And then the next level, so it's like you take each one, you work on, and if that doesn't work, you go to that next level of help. And that next level of help is what social interactions. Who can you call to go out to the movies to brighten your day, or if you're feeling lonely, or you just need to connect with someone?
What a fantastic idea.
And then after that, if things really don't improve, it's how do I reach out? Who do I call? And they would be their primary provider in medicine. They could reach out to their doctor. If they have a mental health provider, they could reach out to the mental health provider. Their local suicide prevention team, which would be our team here in Maryland, or, every VA has a suicide prevention team. So wherever you are, you have a local team that you can also reach out to. And then nationally, that over the weekend, 24 hours a day, 7 days a week, that Veterans Crisis Line is available. That 1-800-273-TALK, which is 273-8255. Someone's there to answer your call and support you. And so that plan basically says, if this starts to go in a bad direction, if I'm starting to feel something that I don't want to feel and I need to get my supports around me, this plan tells me exactly how to do it.
Should every veteran that has had the effects of mental health, or has a mental health disease, or has PTSD, traumatic brain injury, should everyone have this?
It's beneficial to everyone. One of the things we had talked about is that research shows that in their lifetime, millions of people have thought about suicide, self-harm at some point, particularly when they're going through something difficult. And so it doesn't have to necessarily be that they have a history of mental health or substance abuse issues, but sometimes it could be, the older veteran who's struggling with independence and financial, difficulties that might think about suicide, and ordinarily might not be someone we think would be at risk.
And this is to interrupt you for a minute, the older veteran is a group that is seriously on the rise with suicide rates.
Yes. Well, one one of the things I always say is that suicide, unfortunately, is equal opportunity condition, which is unfortunate. But we've worked with veterans as young as 20 and some as old as 95. And so the risk continues throughout our lifespan, as it does in the general population. But for our veterans, as they get older, sometimes they have dementia,
Right.
which would contribute to the thoughts that they may have. They may have PTSD, and so some of their experiences that they had while in the military resurface as they age.
Catching up with them,
Yeah.
and less friends and less family members may be around because
Dealing
of
with all
death.
the dealing with grief issues. Yeah.
In 2014, approximately 65% of all veterans who died from suicide were age 50 years or older.
And I think that's, it actually, it corresponds with the population. We're talking about our baby boomers getting older. So
right.
there's a bigger
True.
population of that age group, but that's what I think we need to pay attention even more.
Let's take a quick break. On that note, we're going to come back and we're talking about some added resources you've gotten in recent history. This is Donna Cole. This is the 1430 Connection. We will be right back. Welcome back to the 1430 Connection. I'm Donna Cole. In the studio with me is Nikole Jones. She's lead suicide prevention coordinator for the VA Maryland healthcare system. Let's talk about the signs. What are some signs that family members need to be aware of, and what can family members do?
So some of the signs are, there's a variety of things. One of the things that is identified is a history of suicidal thoughts or behaviors. So if our loved one has that history, you should know that that makes them more at risk for having repeat thoughts or behaviors.
Is there a difference between suicidal thoughts and the commitment to carrying out?
What it usually is a progression. It starts with the thoughts. They're initially very passive, but if someone's actually taking action, that means you really want to pay attention to that person. That crisis is imminent, and they're thinking about ways to actually do it and then pursuing those means. That really just is a progression of that risk.
Okay. And not everybody's going to let you know they're thinking about it.
Yeah, and that's why it's so important for family to know the risk factors and warning signs too, because someone might not tell anyone. That speaks a lot to stigma. And one of the things I always tell veterans, they say, I don't feel comfortable sharing with other people those thoughts that I have. And I said, but if you were suffering from diabetes, or if you had cancer, would you not want to get treatment for that? And they say, of course I would. And I say, think of your mental health issues as just the same. They are just as dangerous as your diabetes or cancer, and you got to get help for it. Some of the other risk factors, like I talked about, past history, someone with limited supports, chronic pain, and that's a big one with our veterans because they may have served in Vietnam, or maybe some of our newest returning veterans have suffered really traumatic injuries that require that they be on pain medications, which can increase your risk, but also the chronic pain. Just living with chronic pain can be overwhelming.
Is the VA dealing with that chronic pain and the type of prescriptions they're providing? Is there any type of consolidated sort of effort between that pain management and mental health?
Yeah, they actually have mental health providers that actually work in our pain management
Perfect.
clinics, which really are helpful to looking at both, because pain can be psychic and it can be physical. But mental health and substance abuse issues really are another risk factor. If someone suffers with mental health or substance use issues, it can increase their risk for suicide. Disability, a physical disability, but also for our veterans, really some of our newest returning veterans disconnecting from the military and now having suffered an injury and actually pursuing disability, that could be a risk factor because sometimes it changes their ability to care for their family. And so we really reach out to them and connect them with service agencies and state agencies that advocate with them for getting their benefits assessed and getting through the VA benefits system, which has been very helpful. Homelessness, history of sexual assault. A lot of people don't know that sometimes in the military, our veterans are brutally raped, our women as well as our men. And that sexual trauma, we're developing lots of great programs for military sexual trauma, but that can be a real huge risk factor for suicide because they can't get past that trauma.
Right.
But as I talked about, handguns are a big issue, and we really advocate for all of our veterans who have handguns in the home to have a gun lock or a lockbox that they can protect.
Resources for family that see a veteran going into crisis or in the midst of it.
Yeah, and we hear this all the time from our veteran families. They say, well, when he returned, he was just different, or something changed in him or her. And so they may identify those risk factors sooner than the veteran themselves. And they can call the Veterans Crisis Line for a loved one. We encourage the family to call because that can be the first step. A veteran who's really reluctant to seek care, if a family member calls and initiates that process, it can be very, very helpful. So we encourage our family members, veterans, loved ones, even a friend. If you're a neighbor and you see someone who's really struggling, someone who's talking about death or writing about death, planning their funeral, that's something.
Call. The number again is
1-800-273-TALK.
All right. When we come back, what is the VA doing to help reduce these suicide rates? I'm Donna Cole. This is the 1430 Connection. We will be right back. Welcome back to the 1430 Connection. I'm Donna Cole. In the studio with me is Nikole Jones. She's the lead suicide prevention coordinator for the VA Maryland Healthcare System. Tele-mental health services. Tell me what that is, Nikole.
Well, our telemental health services are the use of technology where, say, for instance, in some of our rural areas, we don't have as many physicians. And so we actually have a computer monitor, where a veteran can come into one of our community outpatient clinics and sit in front of a screen and actually see a prescribing doctor or a therapist that's actually at another location. Say, for instance, someone got to know a doctor and the doctor's moving to another clinic and they really want to continue to see that doctor. They could actually come in and see that veteran on the telemental health.
Well, that's an interesting idea.
Yeah. And it really connects. Some people may not be able to travel, and it really actually increases our ability to see more veterans. And that's a good program.
Talk to me about some of the apps that are now available.
Well, let me go back and talk about the Veterans Crisis Line too, because one of the things that a lot of people don't know is in lieu of calling, our veterans can actually chat and text. And this is really important for our younger veterans.
Absolutely. That texting is a big deal.
A big deal. They would prefer to text someone and say, hey, I'm having a difficult time. And so our Veterans Crisis Line is set up to do that. The ultimate goal, though, is to get them on the phone, but initially to get them comfortable reaching out. If they want to text, we want to
Is there a number to text to?
You can text a message to 838-255. That's to send a confidential text. It's available 24/7. And the chatting you can do online at the website, which is the veteranscrisisline.net. That is the best way to reach our younger veterans. We also have a self-check on the app, and they can actually fill out a questionnaire anonymously. That will be reviewed by a provider, and then they get some feedback where they can actually anonymously go in and look at feedback.
Other resources.
I want to talk about the vet centers. They do provide mental health treatment.
Okay.
The difference is they don't have prescribers there, so they're not prescribing medication. But a lot of our veterans may benefit from that therapy. They have group therapy for veterans who've experienced PTSD. They have family groups for family members of veterans who are supporting someone who's been through PTSD. And so the vet centers are a very integral part of our system. We're not connected necessarily, but someone may feel more comfortable going to the vet center to receive care and not the VA. So we want to make sure they know that resource is also available.
And we have a vet center here in Annapolis. There's a facility in Glen Burnie, and then of course the regional center is in Baltimore. For those who have not been there, it is actually a beautiful building. I've been there. I'm a veteran.
Yes. Thank you for your service.
Is there anything that I've missed?
Just want to elaborate a little bit about about what our team does here locally. Once we identify someone that may need extra support, we provide what we call enhanced care. We call them in between their appointments. We send them handwritten caring notes just to say, hey, how's everything going? We're thinking about you.
That's awesome.
We basically check in to see if they made their appointments. If someone has an appointment scheduled and we see that they didn't show, we might reach out to them and say, hey, is everything okay? Let me help you reschedule that. Our main goal is to keep them connected because we know that access to a VA facility, we know our VAs are protective factors. Part of what we do is really that enhanced care is to make sure that they stay connected. And that really is the thing we get across to our audience is that there are resources here. We care about you and want you to be safe.
Nikole, thank you so very much for being here today. I really appreciate it.
Thank you for having me.
One more time on the numbers to call.
The 1-800-273-TALK is our VA crisis line.
And the text?
And the text is 838-255.
Again, thank you.
Thank you so much.
This is Donna Cole. This has been the 1430 Connection. We will see you next week.